Hi, this is Shannon Holton, registered dietitian and owner of Sound Growth Nutrition and Wellness. I wanted to do a short video today to provide a little bit of information for prescribing providers and potential clients interested in understanding a little bit about what my service is, how it works, and what you can expect. First, I started this practice in October of 2023 with the intention of providing greater accessibility to nutrition services in Eastern North Carolina. My practice is largely virtual, so most of my services can be done over a web call that is HIPAA compliant. I also am able, on a case by case basis, to do some home visits for those that need a greater assessment of the home food environment. I also provide contracting services. So if a particular clinic or doctor's office would like to contract to have services in house at their site, I am able to do that as well. Generally, I really do recommend a 3 to 6 visit kind of setup. Most of the research shows that nutrition services are more successful when you have at least 3 visits with a dietitian. So, packages are in the concierge variety, meaning that they are cash packages and can be paid on a monthly basis. The pricing is actually better than a lot of other clinics just because I want to be able to offer this service and provide less barriers to nutrition services. My website does have the information available for each package and what is contained in each package and how that is set up. I do have the ability to work with insurance to a degree. Most nutrition services, unfortunately, especially for adults, are not covered services. So what I can do is provide a invoice with the information that would be needed for an insurance company that the client can submit on their own behalf for reimbursement of what they would potentially get. I'm working through pending processes with several insurance companies to be able to bill directly to insurance. So stay tuned for that. In terms of what to expect, a client will usually have an initial visit that is a little bit longer. If it's a home visit, a lot of times it may be a little bit over an hour, closer to 2 hours. If it's a virtual visit, generally, it will be about an hour where we discuss your history, what's going on with medical concerns, and what your needs are, what your goals are, and then discuss some of the realistic aspects of those goals to make sure that we're all on the same page. In terms of follow ups, that's when we will provide those recommendations and those action plans that you can take home and implement in your environment, and then follow ups to be able to interact about what are some problems that you're having or some troubles that we can work through and figure out the best way to make this a long term success. The other aspect, I do have a secure portal. So I have journaling and messaging to the dietitian, which is myself, that you can do as a client. So if you're registered in my service, you'll have an access to a patient portal where you can have that communication with me. And I can help to provide some interaction or collaboration with your providers as well through that portal. Doctors or practitioners can refer for nutrition services, but patients, because it is largely a non covered service, patients can self refer. So if you come across my website or my information, don't hesitate to reach out. You can always message through my info at soundgrowthnw.com email address and ask any questions that you have about the service. If you are a provider's office and you're interested in learning more about specifics of the services that I can provide for your patients, please feel free to reach out at 252-751-9096 and set up an appointment to have a meeting and discuss what I can do to help your primary care office. I am a registered dietitian, so that means that I can provide medical nutrition therapy, but I can also provide coaching and counseling for general wellness nutrition. I do see pediatric and adult patients through the lifespan. I have over 20 years of experience as a dietitian, so I feel well equipped to meet the needs of any patient population that may come along. In terms of overall types of things, I can take care of wellness for adults and children, weight management or heart health, diabetes care, but also can deal with the more complex. I can help with things like failure to thrive, things like tube feeding questions and needs, formula selection, and other medical conditions like food allergies or even complex metabolic conditions. So I am accessible and available for across the board when it comes to any nutrition condition that you may have a need for. I hope that some of you found this helpful, and please feel free to reach out again if you do have questions. My website and information and social media connections are going to be posted on this video at the end. Thank you and have a great day.